This is the second part of the reproductive system PowerPoint slides. All right, so we begin with the menstrual cycle here. It is cycles characterized by regular recurrent changes in the endometrium of the uterus, and this culminates in menstrual bleeding, or what we call menses. This begins around age 13, continues into the early 50s. And menarche is the first reproductive cycle. And each month, regular recurrent changes also occur in the ovary. So one mature antral follicle will be ovulating, and the remnants of the follicle close up. They close up to become the corpus luteum. In the absence of fertilization, the oocyte will degenerate, and then the corpus luteum also degenerates, and this becomes then the corpus albicans. Phases of the menstrual cycle start with the ovarian phases. So you have the follicular phase. This is the dominant follicle maturing under direction of follicle stimulating hormone. And then ovulation, luteinizing hormone surges will cause the final development of the mature antral follicle and will release the oocyte and the surrounding layers from the follicle in the ovary. And then we move to the luteal phase. The corpus luteum forms from the remnants of the follicle and secretes estrogen, progesterone, and inhibin. Degenerates in the absence of fertilization in about 12 days and becomes a corpus albicans. Okay, the uterine phases. First, you have the proliferative phase, where the endometrium is thickening under direction of estrogen. Then the secretory phase. The endometrium becomes more vascular under direction of progesterone. The uterine glands produce nutrients for possible implantation of the fertilized egg. And the menstrual phase, where the endometrial lining sloughs off upon degeneration of the corpus luteum. And menstrual bleeding will remove the sloughed tissues. Table 22.3 goes over the hormonal controls of the female secondary sex characteristics. So the hypothalamus releases gonadotropin releasing hormone, which stimulates the anterior pituitary gland. The anterior pituitary gland secretes follicle stimulating hormone and luteinizing hormone. Follicle stimulating hormone stimulates the maturation of a follicle. The granulosa cells of the follicle produce and secrete estrogens. Luteinizing hormone stimulates certain ovarian cells to secrete estrogen precursor molecules. Estrogens are going to be responsible for the development and maintenance of most of the female secondary sex characteristics. And estrogens also cause the endometrium to thicken. Concentrations of androgen will affect other secondary sex characteristics, including skeletal growth and growth of hair. And progesterone secreted by the ovaries affects the cyclical changes in the uterus and mammary glands. Table 22.4 goes over the major events in the menstrual cycle. And you might want to pause and read over that particular table or look at it in your textbook. Figure 22.33a and b shows all the events of the menstrual cycle. Okay, clinical applications. Well, female infertility is the inability to conceive a child after 1 year of trying. Males and females contribute equally to infertility, though. 25% of cases are due to more than one factor, according to the American Society for Reproductive Medicine. So the causes of female infertility include anovulation, where you have hyposecretion of follicle-stimulating hormone and luteinizing hormone from the anterior pituitary, and a resulting lack of ovulation. Endometriosis, where endometrial tissue grows in the abdominal cavity, and fibrosis occurs which may encase the ovary or obstruct the uterine tubes. And infections, such as gonorrhea, which can obstruct uterine tubes or cause a production of a viscous mucus that prevents sperm from entering the uterine tube. Okay, let's move on. Menopause, also called female climacteric, the stopping of the menstrual cycles for 1 year. Usually occurs in late 40s or the early 50s. The ovaries no longer produce as much estrogens and progesterone as they did previously, and some females' secondary sex characteristics may disappear. There's also an increased loss of bone matrix, osteoporosis, which may occur. And 50% of women experience hot flashes. Migraine headaches, backaches, and fatigue also occur in some women. Okay, mammary glands. These are accessory organs of the female reproductive system. They're specialized to secrete milk following pregnancy to nourish the baby. The location of the mammary glands, they're located in subcutaneous tissue of the anterior thorax within the breasts. The nipple of each breast is surrounded by a circular area of pigmented skin called the areola. The structure of the mammary glands. The mammary gland is composed of 15 to 20 irregularly shaped lobes. Each lobe contains alveolar glands, and they're drained by alveolar ducts, which drain into a lactiferous duct that leads to the nipple and opens to the outside. Dense strands of connective tissue form suspensory ligaments that support the breasts. Development of the breasts. Mammary glands of males and females are similar. As puberty is reached, ovarian hormones stimulate development of the mammary glands in females, though. This figure shows you the structure of the breast and mammary glands. Okay, clinical application. Treating breast cancer. Warning signs. The area of thickened tissue, a dimple, change in contour, nipple that flattens or points in an abnormal direction, and nipple discharge. These are all signs. A biopsy can confirm whether cancer is present in suspicious tissue. Surgical treatments include lumpectomy, simple mastectomy, and radical mastectomy. Standard radiation and chemotherapy target the rapidly dividing cells. Newer drugs keep signals, estrogens and growth factors, from stimulating cancer cells to divide. Self-exams and mammograms are helpful in finding breast cancer early. Genetic testing can identify women who have inherited certain gene variants that greatly increase risk of developing breast cancer. 5 to 10% of all breast cancers arise from inherited tendency. Let's talk about birth control. So this is the voluntary regulation of the number of offspring produced and the time they're conceived. This control requires some type of contraception, which is a method which can avoid fertilization following sexual intercourse or prevent implantation. There are several methods of contraception with widely varying degrees of effectiveness. Coitus interruptus. This is a practice of withdrawing the penis from the vagina before ejaculation, preventing entry of sperm cells into the female reproductive tract. It's not very effective since sperm can leave the urethra before ejaculation. The rhythm method. This requires abstinence from sexual intercourse 2 days before and 1 day after ovulation. It's not very effective since it's difficult to predict the exact time of ovulation. Mechanical barriers. They prevent sperm from entering the female tract during sexual intercourse. Examples, male and female condoms. And then chemical barriers. Spermicides in the form of creams, foams, and jellies. They're most effective when they're used with a mechanical barrier. Combined hormone contraceptives. They deliver estrogen and progesterone to prevent pregnancy. It contains synthetic chemicals that function like estrogen and progesterone. It disrupts normal follicle-stimulating hormone and luteinizing hormone secretion, which prevents follicle maturation and ovulation. It also thickens cervical mucus to prevent sperm passage. There's various methods used to deliver hormones. The other hormone contraceptives. An intramuscular injection of medroxyprogesterone acetate protects against pregnancy for 3 months. It prevents maturation and release of a secondary oocyte. Intrauterine device, small solid object implanted in the uterine cavity. It causes inflammation that's toxic to sperm and oocytes and prevents pregnancy. Okay, continuing with the birth control methods, emergency contraception. The morning after pill can be taken 3 to 5 days after intercourse. It works by temporarily stopping ovulation. It prevents pregnancy, but does not work if ovulation has already occurred. Sterilization. These are surgical procedures that permanently prevent pregnancy. In a vasectomy in males, we have removal of a small section of the ductus deferens, and you cut the ends and then tie them together. This prevents sperm from leaving the epididymis. Tubal ligation in females. Uterine tubes are cut and the ends are tied. This prevents sperm from reaching the oocyte. Table 22.5 summarizes these different birth control methods. Sexually transmitted infections, or STIs. The term STIs now is used instead of STDs, which was sexually transmitted diseases, because a person can be infected and contagious without developing symptoms of the disease. Symptoms of STIs include burning sensation during urination, pain in the lower abdomen, fever or swollen glands on the neck, discharge from the vagina or the penis, pain, itch, or inflammation in the genital or the anal areas, sores, blisters, bumps or rashes, and itchy, runny eyes. Pelvic inflammatory disease. This is a complication associated with gonorrhea or chlamydia. Bacteria enter the vagina and spread to the reproductive organs, and it can scar the uterine tubes, resulting in infertility. Acquired immune deficiency syndrome. HIV can be transmitted through semen in unprotected sex, but also blood and milk. It causes deterioration of the body's immune defenses. Table 22.6 goes over some of the diseases associated with sexually transmitted infections. And that's the end of the section on the reproductive system.